Cellular adaptation. So before seeing the various cellular adaptation, just let us review. We just read that on a small stimulus, the cell adapts by 4 methods, that is hypertrophy, hyperplasia, metaplasia, and atrophy. Now let us see each in detail. So what is hypertrophy? Hypertrophy is increase in the cell size. Okay, there is no increase in the number of cell. Okay, only the size increases. Now what is the mechanism is that there is increase in the synthesis of proteins. Okay, and this occurs only in permanent or non-dividing cells. Why non-dividing cells? Because there is no increase in the number of cells, so in the non-dividing cells. Now what are the non-dividing cells? We have neurons, then we have cardiac or skeletal muscles. What are the examples? It can be physiological or it can be pathological. Physiological one is uterine changes in pregnancy. Then we have this breast during the lactation. And then we have skeletal muscle in the bodybuilders, okay, due to increase in the workload. Then what are the pathological condition? Two conditions are there. One is left ventricular hypertrophy. Now, why does that occur? Due to hypertension, there is increase in the workload. Then second is bladder obstruction by stone. And what happens here is there is a proximal area hypertrophy. Okay, proximal area hypertrophy. So what is hypertrophy? Hypertrophy is increase in size, not the number of cells, due to increase in the synthesis of proteins in permanent or non-dividing cells like neurons, cardiac or skeletal muscles. For example, it can be physiological, pathological. In physiological, like uterus in pregnancy, breast in lactation, skeletal muscle in bodybuilders. Pathological can be left ventricular hypertrophy. Why does that occur? Due to hypertension, there is increase in workload. Then bladder obstruction by stone, and in this the proximal area hypertrophy occurs. There is increase in the smooth muscle cells also, we can see increase in the size. Then coming to hyperplasia. What is hyperplasia? Hyperplasia means number of cells will increase, okay, and it can also lead to the increase in the size of organ, not the cell. Okay, it is the increase in the size of the organ. Now on persistent increase, it can lead to carcinoma. Now, what is the mechanism? The growth factor induced proliferation of cells occur, and it occurs in the dividing cells. Okay, because there is increase in the number of cells. Now let us see the examples. Now hyperplasia can also be physiological or pathological. Physiological, it can be compensatory or it can be hormonal. Compensatory we can see in the liver post partial hepatectomy, okay, post partial. And this what do you mean by that? If in a liver, like partial hepatectomy is done, then after some time it will regenerate the lost part. Then hormonal, the breast during the puberty or during the pregnancy. What are the pathological conditions? In pathological condition, if there is estrogen excess or it can be androgen excess. In case of estrogen excess, then endometrial hyperplasia will occur, and in androgen excess, benign prostatic hyperplasia will occur. Now there are two conditions which can be seen in both hypertrophy and hyperplasia. What is that? First option is breast during puberty, and the second condition is uterus during pregnancy. Okay, the best option is breast during puberty. So this was about hyperplasia. Coming to hypertrophy. Hypertrophy is decrease in cell size, decrease in cell number as well. Why does that occur? Decrease in protein synthesis, okay, and degradation also increases of protein. Then what happens? Autophagy occurs in this case. Then it can also be physiological or it can be pathological. In physiological, it can be disappearance of the notochord, or we have this thyroglossal duct, and it can be involution of the uterus after the parturition. Okay, then pathological, it can be due to senile, means aging of the organs, or it may be due to disuse is muscular atrophy after fracture, like for a long time there is no movement. Then we have denervation atrophy, means decrease in the nerve supply, then decreased blood supply, or it can be nutritional atrophy, means kwashiorkor or marasmus. Okay, or it can be pressure atrophy. What is pressure atrophy? Means the area surrounded by tumors, that area get pressure, so pressure atrophy can also occur. Then next is metaplasia. What do you mean by metaplasia? Metaplasia is a reversible process, okay, in which one differentiated mature form cell type is converted into another. So there are two types. Okay, one is epithelial and another is mesenchymal. Epithelial means conversion of this epithelium, and mesenchymal means conversion of the connective tissue into something. Here also conversion of the epithelium into some other mature form. Now what is the mechanism? Mechanism is that there is reprogramming of the stem cells. Okay, stem cells reprogramming. And risk factor, there is one risk factor, that is vitamin A deficiency. This vitamin A deficiency can lead to metaplasia. Examples, three major examples, out of which Barrett's esophagus is most important, but most common one is squamous metaplasia in the respiratory tract, in which pseudostratified ciliated columnar epithelium gets converted into stratified squamous epithelium. Now this is reversible. It happens due to chronic smokers, and on cessation we this condition get reversed, and there is increase in the risk of infection because there is loss of the cilia, so there is risk of infection. Now second one is Barrett's esophagus. Now in this, stratified squamous epithelium gets converted into columnar epithelium. Now this is GERD or risk factors, and on treatment the stratified squamous epithelium of the esophagus is comes. Now histopathological remark, there are two histopathological remark. One is intestinal metaplasia, another is presence of the goblet cells. Okay, now the risk factor is adenocarcinoma. Okay, adenocarcinoma of esophagus due to presence of this goblet cells. So there is a risk factor for this adenocarcinoma of esophagus. Why? Due to presence of this goblet cells. Now special staining, see, there is goblet cells. So this goblet cells contain mucin. So what is the stain for mucin? It is Alcian blue. Okay, Alcian blue, or we also call it as mucicarmine. So this is the special staining for this Barrett's esophagus. Okay, it stains the mucin inside the goblet cells. The third one is myositis ossificans. Okay, myositis ossificans. Now this is the example of mesenchymal connective tissue metaplasia. What happens? The muscle changes into bone, means one form of connective tissue changes into another form of connective tissue. Okay, so overall metaplasia is a reversible change in which one differentiated mature cell type gets converted into another. There are two types, one is epithelium, one is mesenchymal. Epithelium means conversion of this epithelium, and mesenchymal means conversion of this connective tissue. Mechanism is there is reprogramming of the stem cells, and there is a risk factor, that is vitamin A deficiency. Examples, three examples. Two examples are of this epithelium condition. It's most common one is squamous metaplasia in the respiratory tract. Remember, respiratory tract, not in the lungs. What happens? Pseudo-stratified ciliated columnar epithelium on chronic smoking gets converted into stratified squamous epithelium, and on cessation it returns back because it is a reversible process. Now this increases the risk of infection. Barrett's esophagus, stratified squamous epithelium of the esophagus. On GERD, means or risk factors, columnar epithelium. On treatment it reverses back. Then on H&E, means histopathological remark, we can see intestinal metaplasia, means we will see that there is stratified squamous epithelium of a specimen. After on further, we will be given that it is a specimen of esophagus, so we will see there is intestinal epithelium or the pseudo stratified columnar epithelium. Now there will be presence of goblet cells. Okay. Now, what are the risk factor? This is a risk, Barrett's esophagus, it's a risk factor for adenocarcinoma of the esophagus, and special staining is Alcian blue or mucicarmine. Okay. Alcian blue or mucicarmine. Now, this stains the mucin inside the goblet cells. Now the third one is myositis ossificans, in which is a type of connective tissue in which muscles gets converted into bone. So this was all about this cellular adaptations.